financial outpouring of democracy. And somebody said, this guy has done bad. The student must have gone and done something. But the anesthetist was very, very sick. He said, no. Anyway, pulmonologist was called. I did a bronchoscopy. Tons and tons of blood we took out of there, and we sent it for everything. And the result came as Buchirelia bankruptcy. So we had the first ever reportable case of Buchirelia bankruptcy causing coronary hemorrhage. But wait a minute. Does this happen? It doesn't. So you have to rethink your way again. And then, because I was working in a hospital, Medicity Hospital, I think Raza mentioned that. Where is Raza? Yeah. So maybe you might have seen this patient. So at that point, we called up the microbiologist. We had to send it to Medwin Hospital. And then I said, ma'am, could this be strongyloids? And she said, yes, officer. So you have to actually, this is basically Theodore Woodward. He was professor of medicine in Baltimore, Maryland, and he was almost with the Nobel Prize for typhus or typhoid work. And he said, when you hear hoofbeats, don't think of a zebra. Think of horse. It's a horse. When you see torrential hemoptysis with Buchirelia, think of strongyloids. Think of the uncommon manifestations of a common problem more than a common manifestation of an uncommon problem. You get what I'm saying? So you have to go for a common entity first. And on his right, in the pride of place, is Viri Sutton, who was not professor of medicine in Baltimore. He was not professor anywhere. He was not a medical doctor. He was a bank robber. And when Viri Sutton was asked by the press, why do you rob banks? So the guy said, because that's where the money is. So this kind of this simplistic thing, that was simplified thinking, but in a way, it's the same. And one of my last patients here, 69-year-old real patients, non-asthmatic male, comes with a, he is not asthmatic, he's coming in with an attack of asthma. It's not a cardiac problem, everything, but he's got significant V's on one side. And then we do a PFT, which shows an obstructive curve. And then we said, no, we can't account for that. Instead of rechecking the spirometry, which we should have done, because if you look at the inspiratory curve, it doesn't go and meet the baseline there. So it was not a properly done PFT, spirometry. We did a bronchoscopy. And in the bronchoscopy, we found pieces of chicken bone on either side of the canal. So we wrote it up as Fahad was the first author here, and we wrote it up as an article called the Carina. Yeah, that is a piece of Carina. This little